Alrighty, good evening, everyone, and thank you for joining our men's health webinar. We're so excited to have the opportunity to share important men's health education with this group tonight. My name is Lee, and I'm the host of tonight's event. I'll start with a couple of quick housekeeping items, and then I'll introduce our speaker. Most importantly, your participation is completely anonymous to other attendees. No one can see your face or your name, and any questions you ask will only be seen by myself and the speaker. We encourage an interactive presentation, so if you'd like to ask a question, please type it in the chat box at the lower part of your screen, and we'll save time at the end of the presentation to answer as many questions as we can. Tonight's webinar will be presented by Dr. Christopher Kim, a urologist and men's health specialist at Georgia Urology. Dr. Kim, I know your time is in high demand, and thank you for being here with us tonight. I'll go ahead and turn it over to you.
All right. Thank you so much, Lee, for introducing me. I want to basically say, commend everybody that's on this talk because first, I always say that knowledge, comes first, knowing what you're dealing with, knowing what the options are. So thank you for taking the time to, invest in this educational session. So first and foremost, we'll define, what is ED, right? We call it erectile dysfunction. It's the persistent inability to maintain an erection, right? That's good enough for sexual intercourse. And it is very common in men. About 1 in 5 men suffer from this disorder. And as we age longer or increase in age, we increase that probability of having ED. What's the process? So first we have to learn about some anatomy. So down below, you'll see the picture of the penis. And it basically consists of, if you want to call it, it's a dynamic, I call it a neurovascular organ, right? It's not just an organ that has tissue, but it has nerves that allow arousal to occur and the muscles to relax as blood flows into the penis, thus stiffening the penis so that it's erect enough for sexual intercourse. So what are some causes associated with ED? There's a lot of factors, but just kind of global overview: heart disease, diabetes, if you have a smoking history as we increase in age, other comorbidities like depression if you're on antidepressants. So some of these things will definitely affect and increase the likelihood of erectile dysfunction. It impacts men in all aspects of life. Essentially, if you have erectile dysfunction, definitely there is a significant psychological component as well, and it'll affect your day-to-day and your intimacy, obviously, with your partner. So direct link between ED and diabetes. I like to say that presenting with erectile dysfunction or having erectile dysfunction is a window into your heart health, essentially, and also your diabetes and kind of sugar control as well. And as we'll kind of highlight, it's all about really the nerve damage that diabetes causes over a long period of time that damages the blood vessels as well as the nerve stimulation that is required for erections, as I showed before in the anatomy pictures. Again, I alluded to heart disease. So sort of, having a healthy heart means having a healthy erection. And so it is something to consider it's not just a silo. We're not just treating urology conditions. That's what I do, of course, but overall, we're looking at the entire picture, right? When you come into the office, we're going to discuss your high cholesterol. We're going to talk about your heart disease and your diabetes. And I'm going to ask you to optimize that with your primary care doctor before we even kind of start, the journey for erectile dysfunction treatment. So this is a telling kind of diagram. So you'll see that, one of the largest diameter arteries all the way on the right, the femoral artery, then the internal carotid. And as we get smaller and smaller, the penile artery diameter is very tiny compared to, let's say, the femoral artery. So you could imagine if you have heart disease that's uncontrolled or, hyperlipidemia, disease, then it's going to slowly narrow the diameter of an already small penile artery and occlude flow to the penis and affect your erection. So how do we reduce the risk? Like I said before, it's my mentors have always told me it's what the patient brings to the table too, right? So quitting smoking, controlling alcohol, controlling stress, exercising, optimizing your cardiovascular health will help optimize other aspects for treating ED. So ED is also linked to low testosterone. So when you come into the office and if there's discussion of having constant fatigue, decreased focus, things like that, it'll definitely be linked to low testosterone. So we'll definitely check testosterone levels along with treating and thinking about a plan for your ED. So some of the symptoms may include, low sex drive, low libido, hot flashes, constant fatigue, depression, and decreased muscle mass as well. So obviously another big component is, when we treat prostate cancer as urologists, especially if you do a prostatectomy, the nerves of the erections are surrounded around the prostate. And, even though we do nerve-sparing technique, most men will have some component of erectile dysfunction that most of the time, as the statistics show, recover in about a year. But for the men that don't recover, this is, obviously a key component in terms of like the journey for ED. So as I mentioned before, there are nerve-sparing techniques, but obviously about 25 to 75% of men, wide range, will have some component erectile dysfunction afterwards. So Peyronie's disease can be a talk in and of itself, but it is a disease where you have a scar tissue calcification or plaque, uh, quite literally anywhere on the penis, but most likely on the dorsal aspect or the top part of the penis, where it'll cause a curvature. And a lot of times this can be also linked with ED and cause a burden as well. So treatment options, there's pills, you can do surgery to remove the plaque, but ultimately, if you have both ED and Peyronie's disease, penile implant, will solve both problems at the same time. So how do we treat ED? Like I said, everyone's part of the team, including you guys, the patients, our general practitioner, us, and the urologist that is able to, provide a penile implant procedure at the end of the day. So this is a global overview of the options, going from left to right, least invasive to most, pills, erection device, injections, and an implant. So lifestyle changes, optimizing your health, obviously is key, and kind of having a good support system is important as you move forward on this journey. Pills are obviously, first line. Many of Cialis, Viagra, Levitra, all these options. They're cousins of each other. They work the same way. They help relax, the penis muscle so that you have better flow of blood into the penis so that you have an erection. Side effects include flushing, headaches. You could have some back pain in some patients, but in most men, they use this in combination with pumps, vice versa, before considering an implant. This is the penis pump. There's a lot of different companies out there online, but essentially the concept is to trap blood in the penis and then put a constriction ring. And as you can imagine, that can cause some penile numbness or bruising, pain and discomfort. So it's not, always the first line option, but it can be used along with some of the other techniques. Injection, again, some men do use this, but it's not the most popular because you have to inject a medicine directly into your penis. It takes away from spontaneity because you have to keep the medicine in the refrigerator, and it can cause scar tissue, penile pain, and bruising as well. Penile implant, which we'll go into a little bit later in more detail as well, is essentially a permanent solution to erectile dysfunction, where the device will be implanted directly into the penis, and allow the user to have spontaneity, pump the device as well as deactivate to have erections as well. So this is the AMS 700 Boston Scientific penile implant. It is coated with a special inhibizone to prevent infections. As you see in the diagram there are cylinders that are inside the body of the penis. There's a pump in the scrotum, and then there's a reservoir in what we call, I guess you can say in the pelvis, that will hold saline for the whole pump system. This is a quick video kind of demonstrating the pumping of the device and how it works. So you can see the user pumping the penile implant in his scrotum. Then you see the fluid move from the reservoir or the bladder of the device and inflating the cylinders that are inside the penis. And then there's a deactivation button, and it releases the fluid to go back into the device bladder, essentially. So what can you expect from this procedure? Honestly, once you do this procedure, you cannot have a natural erection. It is a permanent procedure. It is not a cosmetic procedure. It's not a girth length or lengthening procedure. It is a functional surgery that allows the patient to have an erection from artificial means through an implant. It's a same-day surgery where you go home the same day. Usually takes about an hour to hour and a half to complete, and we usually wait about 4 to 6 weeks to allow for healing, and then you can use the device itself. I mean, fact of the matter is 90+% of patients are happy with the, satisfaction of sexual intercourse, and they would themselves recommend the implant to a friend. Cost, honestly, Medicare and most commercial insurances do cover this, so that will not be an issue. Our offices will work with the insurance carriers and you as the patient to kind of make sure that, all our financial aspects are covered. Possible risks, just like any procedure, bleeding, infection, damage to structures where we're working. With the penile implant or any implant procedure, because we're putting a foreign device into the body, infection is a risk. Device malfunction is a risk as well because it's a artificial device with many different components. Wear and tear essentially from the device and tissue, erosion as well. This is a QR code and a website that will give you some more information on specifics for ED, with videos as well to kind of help, increase awareness and answer some questions. So we're going to kind of shift gears to male stress urinary incontinence. So what is it? What's stress urinary incontinence? Basically, when you have increased activity or you're moving around, laughing or sneezing, that's when you leak urine, you lose that control. And a lot of men are affected by this worldwide. About 13 million men suffer from what we call SUI. Essentially, kind of looking at this picture, up top we have the bladder, in the middle we have the prostate. Then we have our urethral sphincter in the middle there that helps control voluntarily when you want to pee and when you don't want to pee. So this is a little kind of anatomy overview here. What can cause SUI? So sort of like we discussed before for ED, men who have prostate cancer that undergo a prostatectomy or have radiation can have damage to the external sphincter or the functionality of it, and thus kind of weakening that mechanism that we have for continence. And obviously it affects quality of life where you're leaking, you have no control. And so there's a lot of aspects where this touches upon. And as I mentioned before, there's a lot of prostatectomies done in the United States. About 9 to 16% of men, may still have persistent leakage after a year of treatment. So essentially, after about a year of treatment from prostate cancer, most men recover from ED and SUI, but there is a good component that still have symptoms that persist. So how do you treat it? you try to limit your fluid intake, kind of plan around, with, targeted voiding and such. You can do physical therapy to help strengthen those pelvic floor muscles, Kegels, and then, catheters, penile clamps, pads, obviously as kind of like a temporizing measure. And then we have surgical treatments, right? So this is an option called the advanced male sling. And it's really meant for patients that have mild stress urinary incontinence or moderate. It's minimally invasive. It's also a same-day surgery. And, there is a reduction in the number of pads by up to about 77%. How does it work? It's essentially a support mechanism. You see the sling here supporting the urethra, supporting that renormalizing the anatomy to restore control. Then there is a almost like a pump device, kind of similar to the penile implant, which we'll kind of demonstrate with the video here, where you can control a sphincter, artificial sphincter, that's a cuff that goes around your urethra and allows you to compress and decompress the urethra to give yourself control of when you can go urinate and when you need to when you want control to stop the flow of urine. How does it work? In the same way, there's a pump device that's in the scrotum. Then there's a reservoir that's in the pelvis, and there's a cuff that surrounds your urethra. And we'll show this in this video here. So you'll see the patient pumping the device, and you'll see on this left-hand circle, the cuff has coapted or surrounded and given pressure to control or block the flow of urine. And then up top, not demonstrated there, there's a deactivation button that will open that cuff to allow you to urinate. It's a same-day procedure, few small incisions, and we wait about 4 to 6 weeks prior to using the implant to allow for healing of the urethra. Upwards of 90% are satisfied with this procedure. They would also recommend to their family. And again, there's a lot of long-term studies that show that there's a significant reduction in pad usage. And this is meant for sort of moderate to severe stress urinary incontinence. Again, insurances cover this, so and our offices will work with the carriers and the patients about coverage factors. What are the risks? Just similar to the implant procedure, risks include device failure. You could have urinary retention with this if the cuff is too tight. Experience some post-operative pain and device malfunction as well. This is another QR code and a website that will kind of give some more information on SUI and incontinence and bladder leakage. All right, well, thanks.